Hello, my name is Heather, and today I am doing a demonstration speech on how to administer an IV and spike the IV bag. So the purpose of my video is to educate the audience on the proper techniques and steps on how to administer an IV line, including spiking and priming the IV tubing, and then inserting the catheter into the veins. And the points that we're going to cover today will be how to spike the bag and prime the tubing, how to prepare for the IV site, and then how to insert the IV and ensure that the flow is proper through the lines, and then securing the IV to the site that you're using. And the materials that you need are an IV bag. The IV tubing set, alcohol swabs, or you can use the chlorhexidine swabs, which are inside of this little IV kit. And I'll just lay those out on here. Here's the chlorhexidine swab. And then you need an IV catheter and some gloves, and then a sharps container, which is across the room. So spiking and priming the IV bag. Whenever you open the bag, you have to check the name of the solution, and then check and make sure that there's no punctures in the bag, and then also check the expiration date, which this one's 12/20/25. And then you can hang it on the pole, and then you're gonna pull off the tip of it. And then here's the spiker bag. Here, I'll put gloves on. Whenever you do this pull. You want to make sure that you maintain the aseptic technique for doing an IV, just so that you can make sure that all the germs and stuff stays out of the line, and that you don't touch the spiker that goes into the bag, so that it doesn't go into the patient's arm, or into the bloodstream rather, I'm sorry. So then you pull the cap off of the spiker, and you puncture it into there. All IV tubing is different, but for this IV tubing, the little stoppers on the back, you have to hold it down, pull this plunger out, and then once you see the fluid going into here, you'll let go of it, and it'll start priming down the tubing. And then I take the cap off of the end and let the bubbles, all the air, get out of here. So you just let the fluid drain down the line for a little bit. And then you can clamp it off and secure your cap back onto it so it doesn't get dirty. And then you can check through the line and make sure that there's no air bubbles inside of it. And then I just hang it on the side here until I'm ready for it to go into the IV catheter. And then preparing for the IV site, I'm going to take these gloves off. Do hand hygiene. Gonna get gloves on. And next we're going to prepare the IV site that we're going to use. And again, this is a septic technique. It's not sterile, so it just has to be clean. This is a 20 gauge needle. And before you, here, I'm gonna leave that there. And just pull your arm out right here. So you're gonna look for a good vein. Take the chlorhexidine, wipe the area, go in circular motions from inside to out. And then you're going to apply the tourniquet onto their arm, just right above the site that you're wanting to put the IV in. Place the tourniquet. And whenever you place the tourniquet, it's going to make the blood fill up into the veins so that you can, one, see it better, and then it allows for the catheter to fill up with blood better. I'm not actually sticking him.
Yeah, don't stick me.
No, I'm not going to. But here's the IV part, and then whenever you push it up, then it's just the catheter. So whenever you're looking at their veins, so you can use your hand and separate the skin, and then you're gonna put the needle in at a 10 to a 30 degree angle, and then once you get blood return back into the hub here, that's when you know that you're in the vein, and then you pull it all the way back, and it's gonna lock the catheter so that the needle is out of it, and then it's just the catheter that's left underneath the skin. It's not going to stick you. The needle's out. Okay. I'm just holding it there.
Okay. I don't like it.
Okay, and then you'll take the tourniquet off. Now look, just hold that for a second. We'll act like you have clean hands there. All right, and then the next step is you have to secure the catheter. So the Tegaderm dressing, you're going to take this off, and then you have to leave the hub to where it's out and visible, but you're going to take the Tegaderm and put it over top of the IV catheter, and there it is. It's secured into your arm. And then whenever you're finished with that, you have to take tape and just make sure that you secure the IV all the way across it without blocking the bottom of the catheter so that you can see and make sure that it's not infiltrated. And then the IV wouldn't be any good anymore. So then once the catheter is secured, you're going to take the IV fluids, the end of the tubing, you have to connect this other end of it, which is called a medlock. Let that drain out. Get all the bubbles out of it. Make sure that before you stick the solution into it that there's nothing there. No bubbles in the line. And you can clamp it off either here at the clamp or on the plug up here. You're just going to take the IV tubing and secure it into the IV on the patient. And then once you have it all connected and secured and taped down, you can check the lines again just to make sure there's no air bubbles, but you're going to unclamp the bag, and then the fluid's just going to start dripping. And you can check here to control your rate, or if you have an IV pump and it's hooked up to the IV pump, you can control how much fluid is going into the veins. All right, you're finished. I'm sorry.
You're good.
I missed you.
I just don't want you to poke me. I don't want needles.
All right, so today we covered the materials that are needed for doing an IV on a patient and how to spike and prime the IV bag. And then giving an IV to a patient, is what skill like is really important in healthcare, because it's very essential for these patients to get, you know, adequate medicine, adequate fluids. You want to make sure that they're getting the proper treatment that they need. And the more that you do the IV insertions, the more confident you're going to be, and the faster you're going to master this skill. Thank you. Take my gloves off.